o'clock. My name is Molly Dick. I'm the Assistant County Executive Officer for Nevada County, and we're going to go ahead and start this webinar. So I'm going to turn it over to Heidi Hall, Chair of our Board of Supervisors, to introduce us today.
Thank you, Molly, and welcome to today's COVID-19 update from our public health and medical experts. Our panelists today are Ryan Groover, Nevada County Health and Human Agency Director, Jill Blake, Nevada County Public Health Director, Dr. Brian Evans, Sierra Nevada Memorial Hospital CEO, Judy Newland, Tahoe Forest Hospital Chief Operating Officer, and Molly Dick, who will facilitate, our Nevada County Assistant CEO, who will facilitate. Thank you to all of you coming to learn more and to all of the panelists. Today, you will hear an update on the serious situation we find ourselves in here in Nevada County with regard to COVID. I will leave it to the experts to share the data with you and to touch a little bit on what we might expect in the coming weeks. As you may have heard, yesterday, Governor Newsom announced a regional stay-at-home order in order to slow the spread of COVID-19. I want to assure you that the county considers our public health threat serious. We fully intend to continue to stay in alignment with the state's public health guidance and mandate, and we support our public health staff and experts in everything they are doing to manage this crisis, reduce the spread of COVID, and keep us safe. It is imperative that you do too. We want to keep you informed. Nevada County plans to send out code red emergency alert notices to residents and visitors if Nevada County does move into a stay-at-home order due to regional hospital capacity. The best way we can minimize the COVID infections and deaths in this county is also the best way we can support our businesses, our teachers, essential workers, and healthcare workers. That is by wearing a mask properly, socially distancing, and washing our hands. It is that simple. Please continue to take care of yourselves, your neighbors, and your community by doing so. Thank you to all of you in this difficult time. And now I want to turn it back over to Molly to facilitate the panel.
Great, thank you so much, Chair Hall. So first, Ryan Groover, our Health and Human Services Agency Director, is going to provide an update on COVID in Nevada County. Thank you, Ryan.
Yeah, thank you for inviting me to speak today, though I very much wish that it were under better circumstances. The word unprecedented has been thrown around a lot over the last 9 months, and yet I must continue to use it because we are in the midst of an unprecedented surge in COVID-19 cases, both nationally at the state level and then within Nevada County. Nationally, we're at over 14 million confirmed COVID cases. And for a bit of perspective on how fast we're adding new cases, I'd remind you that we didn't pass 10 million cases until November 8th. So we're adding more than 1 million cases per week nationally. We know from previous smaller surges that hospitalizations and deaths lag behind a surge in cases. And unfortunately, we've started to see deaths tick up as well. And we're now seeing records in terms of daily deaths eclipsing the alarming tragedy that we witnessed in March when New York had its hospital system overwhelmed. California has typically fared better than other states, but we are setting grim records here as well. And unfortunately, this surge couldn't have come at a worse time. It takes 2 weeks or more before the impacts of a holiday such as Thanksgiving show up in new cases. And as Dr. Gali, the state's Health and Human Services Secretary, has indicated, it takes a couple of weeks after that before we see a surge in hospitalizations as a result of that. So we still have not seen the impacts of Thanksgiving. It's in that context that the state yesterday announced a regional stay-at-home order based on ICU capacity. Our hospitals have done amazing work developing their surge capacity, building up PPE supplies, and learning how to treat COVID, and we'll hear from them in a little bit in terms of what they've done. But we do benefit from our ability to transfer people to regional hospitals as well, and if hospitals regionally fill up, then a lifeline could be cut off for our county. So this is not unique to us, and that's why the state made the stay-at-home order that I'll talk briefly about regional and triggered by ICU capacity. So briefly to talk about the stay-at-home order, I know there will be a lot of questions and there are still areas where we're seeking clarity as well. So I'll give you a high-level overview and attempt to answer any questions in the chat, and then after everybody's had a chance to speak. But the order that was issued last night includes a statewide ban on non-essential travel, with motels and lodging being limited to house critical infrastructure. And then based on regional data, the state has defined 5 regions which would move to a stay-at-home order for 3 weeks when they dip to 15% of available ICU capacity. So Nevada County is part of the greater Sacramento region, and I've already heard and seen people express surprise and say that we're not similar to Sacramento. Why are we looped into that region? So I would note that we both transfer people to Placer and Sacramento counties, but also that we actually benefit in terms of our ICU capacity from being lumped in with that group, because it's the second best region in the state in terms of that ICU capacity. The greater Sacramento region with the update yesterday was at 22.2% capacity. And the state's modeling projects that all regions in the state will eventually hit that 15% ICU capacity threshold, and that they would expect that in the greater Sac region early to mid-December, so in the next couple weeks. When that happens, many sectors that are currently allowed to operate with capacities or with outdoor allowances will be closed, including bars, hair salons, personal services, movie theaters, and more. And I can place out a link to which sectors those are if somebody hasn't already done it. And then some things would remain open in contrast to the stay-at-home order that we saw in March, including retail, which could operate at 20% capacity, critically given the holiday season. Restaurants would still be open for takeout. Schools can remain open with no change from the current tiered framework, and places of worship also with no change from the current framework. There are many more details out there and more yet to come, but those are some highlights of it, and they've indicated that we will stay, once we trigger that 15% capacity, the region will stay in this lockdown for 3 weeks, and then at the end of that time, based on projections, if the state's projecting that the region will be below that or above that 15% capacity, then we could exit back onto the tiered framework. So I'm sure there will be a lot of questions. And as I said, there are still some areas where we need clarity as well. I'll take a look at the chat, and then I'd like to turn it over to Jill Blake to talk a little bit more about the COVID situation on the ground in Nevada County and some other public health updates.
Thanks, Ryan. Can you hear me?
Yes, go ahead, Jill.
Great, thanks. And I too wish that we were here under better circumstances and that I had better data to share with you, but unfortunately, but I don't. I'll just share with you that from March to October, we had a total of 642 cases. In the month of November alone, we added 706 new cases. So more cases in 1 month than we had in the previous 8 months combined. Just December 1st through December 3rd, we've added another 169 cases. As of yesterday, as per our dashboard, we have 408 active cases, 17 hospitalizations, and sadly, as Ryan referenced, we have 15 deaths due to COVID now, and there will be more to come. We still see that many of the new infections are due to gatherings with family and friends, and the sectors where we see outbreaks or the most cases right now include healthcare. That does include skilled nursing facilities and long-term care facilities, schools and daycare, food service, clerical and office sectors, as well as firefighters. Like most other places, this dramatic increase and escalation of increase in new cases has translated into us having to prioritize the cases as they come in terms of which ones we're doing case investigation and contact tracing on. In general, we're focusing on those living, working, or visiting congregate living settings, or actually congregate settings. It could be school-aged children because they're in schools, but also the elderly and healthcare workers, as well as those who are most at risk for serious illness, including elderly. For those we don't reach out to by phone, we're mailing or emailing them instructions for isolation and for quarantine, and we're asking them to share that quarantine guidance with people who are identified as close contacts. Those are people with whom they spent time within 6 feet of another person for 15 minutes or more over a 24-hour period. For the most part, we feel like people are really helping us with that effort. For the most part, people who identify close contacts, those close contacts are usually people that they care about, people that they want to protect from illness. So we've had community participation in that effort, and we appreciate it. If you are one of those people who ends up hearing from somebody who has tested positive and they identify you as a close contact, please do take the information from them and call us if you have any questions. I do want to say that case investigation and contact tracing are super effective tools in our public health toolbox, and they worked really well when we've had other outbreaks in the county. But when we get to a point where we have widespread transmission in the community like we do now, when we get to a place where disease transmission outpaces our ability to contain it, then we have to switch to from disease containment strategies more to mitigation strategies. And that's what I just described, where we're asking for community for help as well. This is not the ideal scenario, but sometimes it's necessary. The way we're prioritizing our cases is as per recent recommendations that have come out from the Centers for Disease Control, or CDC. And the reason they came out with those recommendations is because so many across the country now are facing that situation where they have to prioritize. I mentioned that we do have widespread community transmission, and we are in the purple tier of the blueprint system, which indicates widespread community transmission. That's based currently both on our cases and on our positivity rate. I do want to say also that when we are experiencing widespread transmission, it's often quite difficult for people to know exactly where or how they got infected. A person may have been out to eat at a grocery store, getting their hair cut, shopping, putting gas in their car, going to work, nothing extravagant or bold. They're just out in the world. And maybe they have somebody else in their household who's doing the same thing. Our director of nursing gave some really sage advice with where we're at with transmission. She said that we should behave as though everyone around us has COVID-19. And that message is not intended to create fear or paranoia, but to instill practices that will keep us all safe. Unfortunately, there's just not a quick fix to this pandemic, but the simple things that Supervisor Hall mentioned, maintaining that 6-foot distance, wearing a mask, limiting your interactions with others can take us far. I'll touch just a bit on testing, because with our increase in cases and with the increased number of close contacts per case and with the Thanksgiving holiday, we saw a really dramatic increase in demand for COVID-19 testing. Nevada County has over 20 testing sites, and that includes private practitioners, clinics, and hospitals, and the 2 Optum serve sites that we have in the county, one located in Truckee and one in Grass Valley. Those are complements to those sites that already exist. As of November 1st, the daily testing capacity of each of those Optum serve sites increased from 132 tests per day to 165 tests per day. And we continue to work on other ways to increase local testing capacity. But there are limitations to the resources that we can bring to the county. There are limitations to the resources that the state has to offer us. So for right now, we're asking that people who don't have symptoms or a known exposure to someone with COVID-19 temporarily postpone getting tested. We know that there's value in asymptomatic people being tested, but again, because of the increased demand, we're asking that some people, again, temporarily postpone getting tested. I'll touch on vaccine planning just for a moment as well. So that is the light at the end of the tunnel, as many people call it. There are at least two COVID vaccines that are up or have been submitted to the Federal Drug Administration, or the FDA, for approval. And my understanding is that they'll be reviewing those vaccines on December 10th. And those vaccine manufacturers are seeking an emergency use authorization. So the nation, the state, every county, we're all preparing for the delivery of that vaccine. Our local role as a local public health department will both be administering vaccines. We'll likely serve as a safety net vaccinator, as we do with other vaccines. And we'll also be the entity that is allocating doses within our jurisdiction to other healthcare providers who will also be administering vaccine. The state has a lot of information on their website about the committees they put together. There is a scientific safety review work group. There is a drafting guidelines work group. There is a community vaccine advisory committee. And they are all providing direction for us at a local level. So they are defining the priority populations who will get it first. We know that we will have an allocation when it is allocated out to local health jurisdictions, which should happen in December. It certainly won't be enough to vaccinate the prioritized populations, but we anticipate that slow trickle in of additional vaccines until we get those priority populations vaccinated, and then we'll be offering it up to the general population as well. So I think that's my update. I think those are the things I was asked to talk about. And again, happy to answer questions as they come up. So thank you for your time.
Thank you very much, Jill. Thank you all for putting your questions in the Q&A. We are responding to those questions, and some of the questions that we haven't quite responded to, we know we'll get to later in the presentation. So please be patient and continue to put your questions there in the Q&A versus in the chat, which is hard for us to respond to directly. So next, we're going to move on to Dr. Brian Evans from Sierra Nevada Memorial Hospital to share an update about the status of the hospital. Thank you, Dr. Evans.
Thank you, Molly. Thank you, everybody. I appreciate the opportunity to talk today. I want to go back to something Ryan said at the beginning of this and just put a little emphasis on it. Ryan mentioned that when there's an event, a gathering like Thanksgiving, we can predict if there's additional cases from that will result in people getting sick at some point in the future, and it may take a couple of weeks before that actually starts to impact hospitalization rates. So when I think about Sierra Nevada Memorial Hospital and other hospitals around the country, we're sort of downstream of those events, and there's a bit of a time delay. What we do not want to have happen is what we saw happen in New York and other places all around the world, where hospital systems and individual hospitals have been essentially overwhelmed with more volumes than they can safely take care of. So when I look back on the timeline of this pandemic, for the most part, we haven't had a huge number of admitted patients at Sierra Nevada, but what we have seen is essentially a progression over the last month or so, where the numbers keep ticking up, and we're starting to be concerned that we could end up in that situation if this community is not very, very cautious. So just to give you an idea of the census, mostly during the pandemic, we've had a couple of patients admitted, 1 or 2 or 3. But over the last couple of weeks, it's been more in the high single digits. And I think our peak number was 10 admitted patients in the hospital, 2 or 3 in the unit, in the ICU unit, and then the rest out on the floor. We can take care of that number. We have the capacity for that. But what we worry about is if that number keeps on going up, if it doubles or triples, that kind of thing, that gets very concerning. We also track very closely our divisional partners. We're part of Dignity Health, and so we partner with 5 other hospitals in the Sacramento region, and we look at their numbers every day pretty much. And what we've seen is about a month ago, the total number of hospitalized patients in those other 5 hospitals was in the 30s. And now it's up over 130. So it's really picked up in the last couple of weeks, which is concerning the entire Sacramento area. And we are not an island. We are absolutely affected by these things. And I'll just mention one of the initial thoughts about how to deal with this pandemic was, well, we can transfer patients from one hospital to another potentially and try to, share resources and share capacity. But realistically, that's very difficult to do when every hospital is sort of filling up at the same rate all over the area. So I'm not sure that that's, a good long-term strategy for this. And I think we really need to be very, very focused on prevention. People ask me quite a bit about, well, what's the capacity for the hospital? How many beds do you have? How many ventilators do you have? And all that kind of thing. And I can tell you the capacity of the hospital in terms of beds and equipment is fine. We have plenty of square footage, and we have adequate numbers of beds. But what is really the issue for not just this hospital, but basically every hospital that I'm aware of is staffing. And so when I talk about staffing, it's physician staffing, it's nurses, it's techs, it's EVS workers, it's food workers, it's pharmacists, it's all of these people that are really required to take outstanding care of COVID patients. And during this pandemic, we've seen essentially all the hospitals are asking for more help from temporary workers, from traveler nurses, et cetera. And so there haven't been enough to go around in some cases. And then we're also seeing part of the healthcare workforce getting sick and needing to go out. And so that's affecting our ability to increase our capacity, as the cases go up. So that's definitely a concern. I'll just mention the ventilators specifically. We have quite a few ventilators. And one thing that people were really interested in ventilators at the beginning of the pandemic and how many did everybody have and all that kind of thing. One thing that's happened with this pandemic is that the way to take care of COVID patients has really become more clear. There's been a lot of good research. There's been a lot of experience about how to best take care of COVID patients. And so now it's become more clear to physicians, hospitalists, critical care doctors that actually it's better to take care of patients without putting them on a ventilator very early on and using other oxygen delivery apparatus, which we also have plenty of here. So that's kind of the capacity issue. On medications, we have access to the medications that have been shown to be helpful and therapeutic in COVID. We have remdesivir. We've given out quite a bit of that, actually. Dexamethasone is another one we've been using regularly because it has shown some very significant benefit in patients. We also have bamlanivimab, which is a hard one to say, but it's a monoclonal antibody, which is used for outpatients, and we've administered that here as well. And then we are absolutely prepared and continue to prepare more for vaccines. So what we're probably going to see here first is the Pfizer vaccine, which is the one that requires significant cold storage. And we already have our super cold freezer that's available for that. But the concern with the vaccines is that there's not going to be huge numbers of doses of vaccines coming out rapidly. And we're going to have to really be thoughtful about the distribution of these vaccines. And we'll get some guidance from government agencies nationally and also from our healthcare system. Certainly healthcare providers and people who are medically fragile will be on the front line of getting vaccines. We're also looking to see Moderna have their vaccine come out, and we'll be prepared for that one as well. Both of those vaccines are mRNA vaccines, and they look very effective. I'll be looking at the data personally, and also we have internal resources to really vet the studies that have been done by these agencies, these companies, to make sure that the vaccines are both safe and effective. And once we've determined that they're safe and effective, we will be recommending them. And I'll be very much first in line to try to get a vaccine myself. I'm not sure if I qualify for the first line, but I will want to get one when I can. And then there's several other vaccines that are coming out that I think will hopefully get everybody to a point, probably by spring, where we can essentially have a vaccinated population. We are working on our surge plans all the time. We've been developing them and modifying them and constantly remodifying them since the pandemic began. We have a lot of surge plans in place, and I think there's a lot of really good work that's been done. But I really just want to emphasize the fact that it is staffing more than anything else. Our ability to take care of COVID patients is going to be most limited by the people that have the expertise to take care of these folks. And so when people ask me, what can I do for healthcare workers that are doing this work, taking care of the community, taking care of patients? The number one thing that everybody can do for these healthcare workers is do not get COVID and don't give anybody COVID. And like it was mentioned before, we don't want to instill fear in the community. I don't think that's particularly helpful, but we want to be very reasonable about this. And if we can limit the spread of COVID-19, we can prevent all of our hospitals from becoming overwhelmed by this pandemic, and we can continue to provide excellent care to the patients that we have. And that is what we need to be doing until we can get a vaccinated population and we can get through this. There's a light at the end of the tunnel. We've just got to get to that point. So with that, I will turn it back to you, Molly.
Great. Thank you so much, Dr. Evans. There are some questions in the chat about Sierra Nevada. I'm going to give you a chance to take a look at those, or in the Q&A. And Ryan and Jill, there may be a few for you to take a look at as well. But next, I really want to get to Judy Newland from Tahoe Forest Hospital. There have been some questions she's been responding to in the Q&A as well, and want to get an update on how the hospital is doing over in Truckee. So Judy, thank you for being with us.
Thank you for the invitation. And really my response is very similar to Dr. Evans. I think we are sort of mimicking exactly what's happening on the west side regarding our seeing patients, our COVID patients, and how many admissions we've had. So just to start, just a reminder, Tahoe Forest Hospital, we're actually servicing Nevada County, Placer County, and Washoe County in all those areas. We've tested probably around 8,700 individuals and have had approximately 460 positive from our testing. All total with all those three counties, it's about 1,000. So we do monitor all three counties. We too, today, I would just say we have seen probably in the last couple of weeks increase in patients that we're seeing. We too have seen a total of 10 COVID patients currently today. We have 6 Our ICU, we have 33% of our beds open, and we're running it today. About 18% of our beds are housed with COVID patients. So continuing to monitor that consistently. We have, as Dr. Evans talked about, we have medication. We do provide remdesivir here. We too have provided patients with the Plamvivabam on an outpatient basis for those patients that test positive and meet the criteria for that medication. So we're happy to provide that service. We also have a surge plan, and we are very sensitive to that. It's changing every day based on our population. But with the increase last weekend of our inpatient admissions, we did actually expand our bed capacity. Usually we run 25 beds. We've now increased that to 32. So not only are we able to meet the capacity for our COVID patients, but we do recognize that we do have a large ski industry. We have for 68 years provided services to that ski industry. We can go anywhere from a population, of 40,000 to doubling, tripling that on a weekend. And so we are anticipating that, and we do believe we have the capacity to provide care not only to the COVID patients, but to the ski industry, which we do routinely do. One of the things we have really been focusing on, so everyone's aware, is really that outpatient component. What can we do on an outpatient basis to keep our COVID patients as healthy as possible? We did open our outdoor respiratory illness clinic in Truckee. We've expanded that through the winter. We've added an indoor pediatric respiratory illness clinic for pediatric patients in Truckee. And then also in Tahoe City, we have added an outdoor adult. We are actually putting in place a COVID nurse navigator. Really, our goal with that is to be able to reach out to every positive patient in our zip code area. Some people do really well and they don't feel they need a primary care physician, or some do, but we want to make sure we touch base with each of those individuals routinely. So that's a new services that we will be providing. One of the things we do depend on, we are a rural hospital. We don't provide all healthcare services here, so we do need to transfer patients to higher level of care. East of us, Reno has been a great healthcare partner for us, in which we're able to transfer higher level of care patients to. And then more recently, we've actually also used on the west side, transferring patients, those that have services that we can't provide. And we do look every day at other hospitals to see their capacity, because most certainly it's important for us to be able to transfer to those higher level of care. And then I think Dr. Evans spoke about also about staffing. Currently, we are able to provide all of our services to our community. We do monitor our staffing daily. They are people too, and we want to make sure that we continue to have those resources. That's important to us. And so we are monitor that and make sure that we can continue to provide that care, and that our staff is available, and so we have a safe environment for our patients. Just emphasizing again, as we have probably all done the last 9 months, really the importance of mask wearing, washing your hands, and social distancing. And again, just making sure we all take care of our physical and mental health will really help us all get through this pandemic. Thank you.
Thank you so much, Judy. Okay, so that concludes our panel presentation for today. We are still responding to some of the questions that have come up in the chat. So I would like to circle back to our panelists and provide the opportunity to respond to some of those questions, or if something else has come up that you feel needs to be addressed. So I see Dr. Evans has unmuted, so I think he's got something to add.
Well, there's some good questions about the vaccines in particular. One question is really good about how long does the mRNA last after you've been given this mRNA-based vaccine. I don't know the answer to that right now, so it's something I'm interested in learning more about. And what I want to do is really dive into some of the science of those 2 mRNA vaccines that are coming out, as well as the viral vector vaccines. The other questions were about side effects, and the side effects that I was reading about with the Pfizer vaccine indicated it had a similar side effect profile to other types of vaccines like influenza, where achiness and some fatigue and some fever was a possibility in some individuals, but it was transient. And there were, at this point, at least no long-term side effects noted from the vaccine. So again, I need to really dig in on that one and really look at what the FDA has to say. But we also have some internal resources at Common Spirit Health who are vaccinologists, and they are going to help really dig in on the safety profile and the effectiveness of these vaccines. So I thought that was really good question. So thank you for those. I'm not sure I've got any other answers than that. Oh, sorry, one other. One other one was, how long is it anticipated the vaccine will remain effective? I don't think we know the answer to that just yet. I think that it's too early in the results of the trial. They're planning on studying and following vaccine recipients for at least 2 years. But obviously these just came out, and I don't think they're going to be able to ascertain whether people have some level of protection for how long. But there is optimism. I do know that one of the things that was brought up with the vaccines is that sometimes viruses can change over time, they can mutate. And with that, the question is, would a vaccine continue to be effective for an individual that received it in the future? And that's one of the reasons why these vaccines are targeting the surface proteins that are a spike protein on the surface of this coronavirus entity, because the spike protein is not likely to change over time, even with mutations in this particular virus. But, you know, again, all of this is very, very new science, and it really does need to be closely monitored. I think that's what I've got, Molly.
Great, thank you so much. I'm wondering if Ryan or Jill wanted to talk a little bit more about contact tracing. I think there was a question about, or maybe it was answered. It looks like it must have been answered because it popped off of the opens. All right, anything else from our panelists that you'd like to share or respond to?
I just respond, you know, I see a question, and I think a lot of people might have that question about, you know, the safety of going into a hospital and emergency department or on an inpatient. And I think I can speak for all hospitals. You know, we take this COVID situation very seriously, and we, you know, monitor the CDC guidelines, California Department of Public Health. You know, we have staff that are in there, and they are it's just as important to them as it is to anybody that has stepped through our doors, that we make sure that we provide a clean and safe environment. So just letting everyone know that when you go into a hospital, that staff, that medical staff and hospital staff take extra precaution to make sure that that environment is safe. And I want everyone to know that they can feel that way.
Great, thank you so much, Judy. Ryan or Jill, anything that you'd like to add?
I think one of the questions now is one that we just answered about the vaccine, if the virus mutates over time. So I think we covered that. Some people are becoming sick after recovering initially. That's after being infected with COVID as opposed to a vaccinated person. I have heard that has happened. Yes. Oh, somebody had asked about the number of beds at Sierra Nevada. So Sierra Nevada does have a 10-bed ICU. It is typically limited to 4 ICU beds under normal circumstances, but we can certainly increase up and fill up the ICU with more patients in the case of a pandemic. We also have in our surge plan the ability to expand outside of the intensive care unit as needed. But again, it really boils down to staffing. Yeah,
thank you, Dr. Evans. And I just want to point out, if our audience hasn't seen it yet, on YubaNet, Pascal recently posted a press release from the Yuba County PIO announcing a public health advisory in effect through December 22nd. And really, to your point, the press release says that hospitalizations of the Yuba Sutter residents have nearly tripled in the past few weeks. And at the time of this advisory, ICU beds are full. Previous plans for alternative care sites are no longer feasible due to staffing shortages all over the state and country. And so that's the situation in our neighboring county, Yuba and Sutter, and their healthcare system. So pretty dire situation in the county next door. So I want to let you know too, there were a couple of questions about support for businesses. Again, this is a terrible time of year for businesses that have already suffered so much through this year to need to be closing again or reducing their capacity. There are additional state resources that have been made available to businesses. I posted a link in the chat to sort of the landing page on the state's website that has links to all of those programs. There's loan programs, there's grant programs, depending on the size of your business and various criteria. We do host a regular COVID business task force meeting that the county hosts typically on Wednesday afternoons. The next one will be next Wednesday from 3 to 4 p.m. And the focus of that task force meeting really will be to dive into those programs for businesses that are now impacted once again and trying to figure out how to get through the winter season. So that information, you can email our COVID-19 recovery email address if you're interested in getting information about how to participate in that meeting next Wednesday from 3 to 4 to learn more about that. I would also encourage you to reach out to the Sierra Business Council that has also been an excellent partner to help businesses in our community navigate those programs and complete their applications. So those are some resources. Again, the COVID-19 recovery at co.nevada.ca.us is our general email address where businesses can ask questions about if their sector is open or closed and ask for assistance for guidance and other questions. We've also had some questions about enforcement and how the public can let us know if there's a business that they think is not in compliance with the guidance. We do have a reporting system. There's a link to it right on the homepage of the county's website, mynevadacounty.com. If you scroll down to Ask Nevada County and click on that button, you can let us know if there's a business that we need to reach out to and have a conversation with them about what's going on and how we can support them to be safe and to keep our community safe. So those are some resources that are available. I do want to ask Chair Heidi Hall if she has any final words for us or before we wrap up today.
I just want to thank all of you on the panel for your excellent continuous efforts. We know how stressful this is. I can only imagine actually how stressful it is for you, as well as the healthcare workers and all of our essential workers out there trying to keep themselves safe and also keep the community safe. So just huge thanks to you, huge thanks to the community. I know, so I hear from so many of you that you're really doing your best efforts to stay safe and also keep your neighbors safe. The great news is that there is a light at the end of the tunnel with these vaccinations coming. So please stay the course. Please, please double down and stay the course on following the public health mandates. That is the best way to get us through this, to support our businesses as well as our healthcare workers and our families. Thanks everyone for tuning in to get this information.
Great. Thank you so much, Supervisor Hall. And we are going to wrap up this meeting. If there's any other questions we haven't touched on, we will try to get to those. And this meeting was broadcast live on YouTube and will be archived on YouTube to be watched again later or shared with people who maybe weren't able to attend today. So thank you so much. Stay safe and let's keep Nevada County strong. Thanks, guys.
Thank you.